We have Dr. Subramanian Swaminathan, who is a senior consultant, infectious diseases, who is joining us from the Global Health City, Chennai and Bangalore, and right now in Chennai, and Deepak Paliwal, who is a vaccine volunteer, who is joining us live from London. Dr. Swaminathan, Kerala, Maharashtra, Uttar Pradesh, West Bengal, Chhattisgarh, these are the main states that are contributing to nearly 62% of the total active cases in the country. How are you viewing the preparations that are currently underway, the two-day mock trial that happened, and now we are looking at a phase-wise manner that the mock trial will be conducted pan-India?
This is a model which is being used worldwide, and it makes the greatest amount of sense. You need to understand where the return on investment is most important. So obviously, safeguarding our frontline workers is going to be the first priority. That includes people in administrative posts, people who are essential services like law and order, fire, defense, and things like that, as also healthcare workers. Once we get that in place, then we should roll it out to the most high-risk population and then move outwards into the community. The first part of it should be fairly easy to do because we have a captive audience in terms of administrators and healthcare workers and key organizational officials. But beyond that is going to be a little bit of an organizational challenge. We have never done adult vaccination in this format before, whereas the Western countries routinely do that. So for us, it's going to be a little bit of a challenge. So it requires a lot of planning and education of the people so that we can do it without too much disruption.
All right, Mr. Paliwal, if you're talking about various improvements that can be made and specifically talking about the UK, how is the rollout program now looking as of now? You being a volunteer yourself and kind of right from the ground, how to exactly begin to give out vaccination, from what are the categories that have now been defined, and probably till the last common man when the vaccine rollout will be administered. How is it working there in the UK, sir?
Good morning to all. I think it will be not a tough task. I think if we think 11 months back, we were even not aware whether we get a vaccine. If within 11 months, we can get a vaccine for this pandemic, I'm 100% sure that all the people around, the governments around will definitely make sure that the vaccine reaches the most interior part of the villages or the rural places. It will be a challenge, but yes, I think we'll be able to do it quite successfully in India. The governments are playing a role, and it started quite simply in UK. They started sending the letters to the care homes first and above the 80 years. So that was the priority. And then the priority was the healthcare workers who were on the forefront. So every person who was supposed to get the vaccine, they were sent a letter. And I think you must have already heard that there was a change in the policy, how the vaccine was given. So there are, as everybody knows, there are 2 doses. So instead of 2 doses within 28 days, the government has delayed in UK now. So they are giving the second dose after somewhere around 2 months, so that more number of people can be vaccinated. So they will be giving the 2 doses, but the time period between the 2 doses has been changed. So these are the small little things which I think the governments will manage, and they need to manage how to get maximum people vaccinated. And as Dr. Subramanian was saying, we need some education at all levels.
Oh, absolutely that. Dr. Swaminathan, because if we talk about right from the beginning to the end, of course, the finish line is far from now. But looking at the current situation, sir, what do you believe is the priority list? Right now, we don't see children also being included there because we see what happens during a lockdown is that schools and colleges are the first institutes that get shut for the lockdown that we've been witnessing for the last 9 to 10 months, sir. But talking about people who are the healthcare workers, the frontline workers, people with comorbidities, these are the initial priority line that we are looking at. And when does the actual common man get administered the vaccine?
See, unfortunately, unlike the Western world, we don't have databases on all these things. UK, US, and most Western countries have a clear list of their older people. They have a clear list of people who are on dialysis and all kinds of things. We have no such list. In fact, we don't even have a list of all the doctors who are still alive and practicing. Even people who are dead are still registered in all kinds of registries, and the system has not been updated in God knows how long. So the problem is we really don't have this. And so once we move out of a structured area like healthcare and administration into the general public, it's going to be a challenge. And unfortunately, in India, please understand, vaccination is still considered a priority for children. And I foresee parents bringing their children and saying, why are you not giving my child? My child is so small and helpless. Shouldn't the child be vaccinated? Shouldn't the child be vaccinated? So I think a lot of education needs to go into it. A lot of planning needs to go into it. Yes, we can do it, but it requires a lot of attention to detail, a heck of a lot of planning, a lot of dry runs in this area, and probably doing it in a phased manner. Here's the problem with delaying the vaccine by 2 months. Please understand that with the Oxford vaccine, unlike the Pfizer and Moderna, the seroconversion rate with just one dose is actually quite low. You need the second dose to really push your immunity along to get it to reasonable levels so that you get close to 70% immunity. I am not in favor of delaying it to 2 months or 3 months. They've said up to 3 months and things like that. I'm not in favor of that. I would rather get the 2 doses done at the earliest possible so that you get the highest levels of disruption of transmission in a given community rather than doing a half-assed job in all over the country. See, I think we need to look at it in terms of how quickly you can shut it off in as many places as possible and then move outwards as well. At the same time, prioritizing the importance of having as many people getting vaccinated. But I think delaying the vaccine is also common for very sound criticism from the intellectuals in the UK as well.
But Mr. Paliwal, it was on the 8th of December 2020 that the first person in the UK, rather in the world, also received the COVID-19 vaccine approved for general use. Now, this event truly marks the beginning of the end of COVID-19, but do you believe that also raises a whole load of new questions? Because UK government till now has said that it is not mandatory for everyone to get vaccinated.
Exactly. I think you're right. It cannot be mandatory. It's a personal choice. But then once again, the education plays a very important role. How we educate the people around what is the importance of getting vaccinated. And unless we all put in efforts the way we have put in to fight this pandemic till date, we'll not be successful. And it's just a start. And it's going to not end by tomorrow or day after. It's going to take at least mid of next year. And more we educate people around the benefit of vaccination, benefit of getting vaccines. There are people apprehensive about this because it's quite obvious. People are, this has never happened, that you get a new vaccine in 11 months of time. There are concerns, but I think if you take me, I took my first dose on 11th of May, and the vaccine has worked, and I'm talking to all of you.
Oh, absolutely, because that is on the other side, Dr. Swaminathan. We just keep ourselves safe and sound and still follow all the COVID-related protocols.
Yeah.
But this is not the time to let our guard down because what we've been witnessing as India is concerned, the highest recovery rate so far. But it seems that what is being said right now that there is less probability of another COVID-like wave that can be witnessed in India. So far, India has controlled it in a very good terms, but otherwise in European countries, we're looking at lockdown measures being reimposed. But Serum Institute's vaccine candidate Covishield getting the SEC's green signal, Dr. Swaminathan, how do you believe now when it comes to multiplying the dosage in the coming few months, as you've raised certain questions there, but we are still awaiting a nod from the DCGI, I beg your pardon. Yeah.
DCGI. So, see, the good news is we are a country which traditionally accepts the value of a vaccine. So that's a really good thing. Like my friend has said, in the Western world, these vaccine naysayers and these vaccine doomsday people, the fringe crazies, I'm sorry, I don't have time for them, but they do form a significant portion of the population, and that's a problem. Fortunately, in India, we have a lot of faith in the concept of vaccination, and that's something we need to leverage very, very aggressively. And second, as far as mass education campaigns are concerned, let's look at how effectively we managed to get HIV stigma down by doing mass education campaigns. We could do something which has the same ideas to push this concept of vaccination in a tiered way to the community so that they can accept it, understand it, and move along with it. I think most of it is good, information. The fact that we are so close to a vaccine is good, but I mean, I said this 2 months ago that I don't expect a second wave in India for various reasons. The Western world still has a lot of vulnerability, and therefore it is understandable that their wave right now is worse than the first wave. And therefore, that also is an advantage because they are both fighting the COVID wave and vaccinating on a war footing parallelly, which becomes a massive headache. Here we have the advantage of focusing on the vaccination while we are not taking a solid beating in terms of numbers. And I think it also needs to be said that the mask is here to stay for the foreseeable future. Last year, I said we are expecting numbers to stay high till at least Diwali, if not a little later. I'm expecting that mask usage is going to be required at least till this year's Diwali. So let's be prepared for a mask year this year as well, because it's safer that way, and it makes a lot of sense because to get a critical mass of people vaccinated to disrupt transmission is going to take time. We are a huge country, huge numbers, and for it to be administered to enough number of people is going to take time. So let's be patient and make sure that we don't forget about the personal responsibility that we all have in preventing transmission.
Of course, it doesn't mean that the vaccination will be giving you the signal to go out anywhere in, crowded places or so ever, because such kind of risk cannot be taken at any cost. Be it the New Year's, be it other festivals, like Dr. Swaminathan is saying, maybe the Diwali this time round again will be a must one. We have Dr. Manit Arora also joining us this morning. Good morning to you, Doctor. Looking at the dry run that is being conducted, the need for a perfect calibration, do you believe, is the key between the administrative and the medical officers to make it glitch-free and enable mass implementation of the vaccination drive?
Yes, absolutely. And I think that when it comes to the vaccine, there's a few things that are very important that people are missing out on. There's the two most important parts of any vaccine are efficacy and safety, right? So with the new Oxford vaccine that we're talking about, its efficacy is only 70%, right? And that's one of the things that the medical professionals have to tell the public about as well. Even though we're doing an excellent and a commendable job of rolling out the vaccine ahead of time, ahead of everything else, when your efficacy of a vaccine is only 70%, that means if you administer it to 10 people, it only has efficacy in 7 of those 10 people. So out of those 10 people, 3 will not have an immunity built up to the virus. Now, when we're talking about India, as Dr. Swami was saying, one of the negatives of our country also is the large population. So when we're talking about the efficacy, we're talking in millions. In our first round, we're expected to vaccinate around 200 to 300 million people. So that means with the efficacy of around 70-80% if we take it as per the trials, that means out of 300 million people, there are going to be 80 to 90 million people that are not going to have immunity to the virus even after the vaccine is administered to them. Now, the benefit of the vaccine is it's very safe. So we know that even if you administer it, there's very few side effects, there's very few complications. So from a safety portfolio point of view, it's very good vaccine, but we really have to question the efficacy when we're rolling it out. Now, what's the competition? What's out there on the market? So the Pfizer vaccine, the Moderna vaccine, the good thing about those vaccines, they have a much higher efficacy. But the problem is in a country as vast and as widespread as India, that it cannot be delivered to the masses during a time of a pandemic. So it needs extremely cold storage, and we don't have that facility available here. The Oxford vaccine, the COVID shield, they can be administered at 2 to 8 degrees temperature, which is the refrigerating temperature, and that allows for mass population, mass vaccination campaigns. And we really need to get the public on board. So we have to tell the public about all these things, educate them, as Dr. Swami was rightly saying. You have to really tell the public, and at the end, whether you want a vaccine or not still comes down to patients' rights. So that's something we should not ignore. The right of the patient to choose whether they want to have a vaccine or not, once they know about its efficacy and its safety.
Absolutely. But Dr. Arora, as you've been mentioning, because it is very good that AstraZeneca has got approval for its vaccine by the UK regulatory authorities. They also have robust data, something that Dr. Swaminathan mentioned, that it is not yet developed so much in India, looking at the sheer size of the population. But Dr. Arora, do you believe that this is a big step forward, not just for India, but many parts of the country as well in the world? Because it is unlikely that the UK strain, even it has entered India, right now the cases are right now at 29, I believe, but is causing a significant effect on our cases and hospitalization as well. Do we need to worry?
Yeah, of course we need to worry. I mean, what's not to worry about? We've worried through 2020. Now we've got this mutated strain that's come out in the UK. And where did this mutated strain come from? So they've started the vaccinations in the UK, and everyone keeps talking about, look at the data, look at the efficacy of it in the studies. If you really go into the Oxford studies, which is something that I've done and our group has done here, and if you look at the true data, so it's only 70% efficacy. There's only a 70% efficacy. Now they are quoting 90%. That is only in a subset of people. The problem with the vaccine, what I feel personally, is that it requires 2 doses that are staged 3 months apart. So with any vaccine where multiple doses are required, it reduces its penetration rate. So that means if I'm getting a vaccine dose, now somebody tells me, okay, you have to come back after 2 to 3 months to get another dose. In a country like India, we may say, ki, acha, mujhe pehli baat to hua nahi, I didn't have it the first time, so why I need to go back and get the second dose? But its efficacy is really built on that second dose. It's not built as a single dose, one shot cures all type of vaccine. It's built as a 2-stage vaccine spread over a period of 3 to 4 months. And even then, its efficacy is only 70%, as I was saying. And if you look at the efficacy that they're quoting of 90%, that's only in a small subset of patients they tested, which was healthy adults living in the UK, and it was a predominantly white population that was tested. So the number of patients that have been tested in India is actually quite small for the Oxford vaccine. And so we have to see. I mean, the jury's still out, I think, as to what the best vaccine is. But absolutely, 2021 has started off on a great note that we have a vaccine that has come out, and people are, lining up to get the vaccine. And our government is doing a splendid job of having a program, and they've done all the dry runs and everything, and they're doing that right now as well, of having the delivery system in place for the vaccine to roll out with efficacy.
Absolutely. And it does not come with a guarantee that we Indians would mostly like to find out about whether the efficacy of the vaccine really works out on ground. But this is actually the teamwork that we are looking at, the dry run with such a mammoth exercise that is being conducted. And the health minister also said it is akin to holding general elections in the country once again. But this is the exercise of the vaccination, which is so integrally based on interaction and the involvement of the masses and the relevant stakeholders. Thank you very much to all our guests joining us here on the broadcast. Mr. Paliwal, Dr. Swaminathan and Dr. Arora for joining us here on Republic. Thank you very much.